Good morning, Rabbi Krause, Deborah May, Doctors Lerner, Milner, Rocker, and Lisker, nurses Esther and Russi, Rebecca Ostranagata, parents, and seventh graders. Thank you for joining us this morning. Before I turn the stage over to our students, I would like to share a bit about the process that led us here today. This year, our seventh grade science curriculum has been geared toward understanding previous pandemics in history, COVID-19 specifically, and the vaccines that have been developed this year. When we were done learning the numerous science concepts necessary to understand how COVID-19 disease affects us, how our body fights it, and how the vaccines help us to do so, the students were challenged by Rabbi Krause to come up with a recommendation for you, the Health Advisory Committee, as to whether or not SAR should mandate this vaccine for the 21-22 school year. To that end, all seventh graders researched either the halachic, legal, economic, or scientific aspects that were relevant to this question. Each pod held their own debate, and then the students voted to decide which recommendation should be made to you today. A select group of students volunteered to present to you on behalf of their peers, make their recommendation, and support it with the compelling arguments they felt were most pertinent. Without further ado, let's begin. And I'm just going to remind my students who are presenting, you may take off your mask while you are talking. Don't forget to unmute and spotlight yourself. And let's begin. Daniel, take it away.
Yeah. Good morning. My name is Daniel Hershout, and I would like to thank all of you for taking the time out of your busy schedules to attend this Zoom and allow us the opportunity to present our vaccine mandate recommendation on behalf of SAR's seventh grade class. My partner, Benny Rosenboom, and I will begin by summarizing the most recent statistics of this pandemic and its effects globally and locally. According to Johns Hopkins Coronavirus Tracker, as of June 11, 2021, there have been approximately 175 million cases of COVID-19 throughout the world, causing over 3,775,000 deaths. In the United States alone, there have been over 33 million cases, and unfortunately, we just surpassed a total of 600,000 deaths in the country alone. The peak of COVID-19 cases in the U.S. occurred on January 8th, when there are 300,779 confirmed new cases that day. That was immediately after the holidays when people were gathering with family and friends, even though rates of COVID-19 infections were already high. Thank God, the first public coronavirus vaccinations from Pfizer in the United States were administered on December 14, 2020, just over 6 months ago. As the Pfizer and Moderna vaccines became more widely available, we began to see a drop, bringing us to an all-time low on June 10th of only 11,841 new cases in our country. This is the lowest number we've seen since March 25th, 2020.
Benny, you need to unmute. Benny, unmute and start again.
As of June 10th, according to the New York Times, 52% of the U.S. population has had at least one dose, and 51% of people aged 12 and up are fully vaccinated. We are doing better than the national average here in New York, but we still not have had reached levels of herd immunity, which is predicted to happen when 75 to 85% of the population is immune. As of this morning, according to Governor Cuomo, 70% of adult New Yorkers have had at least one dose, and our 7-day average positivity rate is less than 0.5%. Our governor has promised that when we reach 70% vaccination rates, most of the remaining COVID restrictions will be lifted. We await those exciting announcements today. Unfortunately, the vaccination rates have dropped since April 13th. Vaccine providers around the country are administering about 1.14 million doses per day on average, about a 66% decrease from the peak of 3.38 million vaccinations reported on April 13th. As vaccinations appointments are widely available, many of those people who wanted the vaccine have gotten it, and the decrease in vaccination rates is mostly due to vaccine hesitancy. And the best way to end the pandemic, though, is through vaccination and herd immunity. To that end, we, the seventh graders at SAR, are recommending that the Health Advisory Committee mandate the COVID-19 vaccine for all faculty, staff, and students once it is widely available for our age group. We will support our recommendation with halachic, legal, economic, and science perspectives.
My name is Nava Pollock, and I will summarize how the Moderna and Pfizer vaccines work. Although both of these companies are using a new type of vaccine technology, the research that led to this medical breakthrough has been ongoing for many years. Understanding how these vaccines work and why there should be confidence in their safety is important for making a decision about whether to mandate this vaccine for our SAR population, especially our young students. To understand these vaccines, we must understand mRNA, messenger ribonucleic acid, which we studied at length in school. DNA, our genetic instructions, contain numerous smaller pieces of genetic material called genes, which code for very specific functions or proteins in our body. Each gene in our DNA code is transcribed into a copy called mRNA in the nucleus of our cells. This mRNA travels outside of the nucleus to organelles called ribosomes. It is here that the mRNA codons, composed of 3 nucleic acid bases, get translated as the corresponding amino acids are connected to form the intended protein. These mRNA molecules or instructions are destroyed and recycled after they are used by the cell and its ribosomes. Both the Moderna and Pfizer vaccines are made of strands of mRNA encased in a lipid shell. After injection, the lipid shell allows the vaccine particles to enter our cells through our cell membrane by a process called endocytosis. The mRNA strand makes its way to the ribosomes, which then translate this genetic code into the protein spikes that are found on the outside of COVID-19 particles. It's important to note that the synthetic mRNA found in the vaccine contains instructions only for the viral spike protein, but not the actual COVID-19 virus. Therefore, there is no risk that someone will develop COVID-19 disease from the inoculation, which is a tremendous benefit of this new type of vaccine. Once the spike proteins are made by our cells, they are embedded into our cell membranes as they would be on a COVID-19 virus. Our immune system now gets to work. Although there are various mechanisms through which our immune system responds, one of the most important is the following. A white blood cell called an antigen-presenting cell shows our helper T cells what to look for. Next, the B cell creates specifically targeted to the spike found in the vaccinated cell and COVID-19 particles. Our immune systems are now armed with antibodies and memory cells to fend off the virus quickly if we are exposed to it in the future, reducing the risk of infection, transmission, and serious disease from this pathogen.
As a modern Orthodox school, Halacha Considerations become most important when making any decision. My name is Serena Waxman, and along with my partner, Zach Goldstein, we will present 4 halachic arguments that support our class's recommendation to mandate the COVID vaccine. Firstly, we will explain how we are supposed to do whatever we can to extend human life. Secondly, we'll show how we are allowed to take small risks to protect ourselves from greater risk. Thirdly, we'll examine how Hashem wants us to protect our lives, and by not doing so, we would be disrespecting him. And finally, we will explore the halachic issue of leaving ourselves susceptible to COVID-19. Let us begin by turning our attention to our first point, which is that Jews are supposed to extend life, even if it violates another commandment, such as kashrut or Shabbat. According to Tosfot Masachet Avodah Zarah, Daf Kav Zayin, Amud Bet, which says, and I quote, "One removed the debris from him on Shabbat out of regard for Chayei Sha'ah." Chayei Sha'ah is the idea of extending life for the moment, even if only for a short amount of time. As can be seen from this quote, we are concerned for Chayei Sha'ah to the point where we are told to violate Shabbat, even if it will extend life only for the shortest amount of time. This same Tosfot also says, we set aside that which is certain, death, to act on that which is uncertain, potential for longer life. We know and are certain that COVID-19 has the potential to cause serious disease and death, as we have seen almost 600,000 fatalities alone in this country. Vaccination, which renders protection against this disease, will provide potential for longer life, especially if everyone gets vaccinated and we achieve herd immunity. Even if we don't have long-term studies and are not fully certain of every possible outcome of this vaccine, we do know that it saves lives and that it should be our halachic priority. Now, let me turn to our second point, which is that halacha allows one to take a small risk to prevent a greater risk. To paraphrase Abraham Nanzig, in a published letter from London, 1785, entitled Aleh Terufah, smallpox is so widespread and so contagious that everyone should be considered at risk, and therefore the benefit of the vaccine, even one that is new and without a long track record, as Jenner's vaccine was at the time, outweighs that risk. In other words, the greater societal benefit of taking the vaccine, along with the serious consequences of contracting the disease, outweighs the risk it might pose to a few individuals. In the 1800s, smallpox vaccination was a heated halachic topic, and the question was again asked whether halacha permits one to undergo the smallpox vaccination, which contained a live viral component and came with some risks of viral infections and severe complications. Israel Lipschitz, who ordered Tiferet Yisrael, a commentary on Mishnah, says the following on Yoma Boaz 8:3. A healthy individual is permitted to undergo smallpox vaccination, which causes death in 1 in 1,000 individuals to attain long-term immunity. Kal v'chomer, the vaccine that causes death to 1 in 1,000 people is permissible. A vaccine with no known real repercussions should be encouraged if we can attain long-term immunity to COVID-19 disease. In his commentary, Israel Lipschitz broadens the definition of Chaye Sha'ah to include situations where the cause of death is not present but is only a statistical possibility. As reported by Forbes, COVID-19 has increased the risk of death by 10% for the average American. Since this cause of death is a real statistical possibility, vaccination, which has little, if any risk, should be halachically mandated.
Our third point is that Hashem wants us to guard our lives, and by not doing so, we are disrespecting his will. According to the opinion of Nishmat Avraham, Choshon Mishpat, Taf Chaf Zayin, Halakha Yud, and I quote, the Torah wants us to be careful about guarding our life, unquote. In Dvarim, Perek Dalet, Pasuk Tet Vav, it says, V'nishmartem me'od l'nafshotechem, meaning, guard yourself very carefully. Additionally, in Vayikra, Perek Yudchet, Pasuk Hey, it says, Yaseh otam ha'adam v'chai bahem, and Hashem is saying, follow my decrees and live by them. We should guard our lives so that we can live to follow his commandments. What better way to guard our lives than by getting this COVID-19 vaccine? Furthermore, the Choshon Mishpat, Nishmat Avraham, quotes the Be'ir HaGolah, who says, quote, and he who endangers himself has disgusted the will of his creator, and there is no greater profane disrespect than that of Chilul Hashem, unquote. If we do not get vaccinated, we are endangering ourselves by leaving ourselves susceptible to COVID-19, an act of tremendous disrespect to Hashem, since he desires that we live to follow his ways and laws. To conclude our halachic argument, in addition to guarding our own lives, we are commanded to protect others from harm. As it says in Vayikra, Perek Yutet, Pasuk Tet Zayin, Lo ta'amod al dam re'echa. Do not stand idly by when your friend's blood is being spilt. Furthermore, according to Rambam, Hilchot Rotzeach v'Shmirat HaNefesh, Perek Yud Aleph, Halacha Daled, and I quote, with every stumbling block, which is mortal danger, it is a positive commandment to remove it and to guard against it, unquote. And if one does not do so, they have transgressed the prohibition of causing bloodshed. Since COVID-19 carries the risk of mortal danger to many groups of people, it is a positive commandment to do whatever we can to prevent the spread of this disease and to end this pandemic. Scientists have argued and proven the best way to do this would be through vaccination. We hope we have shown how deeply our Jewish tradition values human life and that little else holds greater importance in Halakha. After researching the opinions of our halachic giants, we feel strongly that the vaccine should be mandated and that those who could not get vaccinated, barring medical reasons, are actually violating a positive commandment. Thank you.
Good morning. My name is Adarat Maslow, and with my partner Hilal Lozer, we will be presenting why SAR should mandate this vaccine from a legal perspective. Let's begin by looking back in history for a bit. You have heard about the halakhic precedent that was set regarding the smallpox vaccination, but smallpox also set precedent in our own country's legal system. In May 1901, a smallpox epidemic began in Boston. In order to prevent further spread of this deadly disease, the Cambridge Board of Health ordered its residents who had not received the smallpox vaccine since March 1897 to be vaccinated. A pastor who resided in Boston, Henning Jacobson, refused to comply with the Board of Health's vaccination order since he experienced a serious reaction to the same inoculation as a child. He was charged with violating the law, and his case made it all the way to the Supreme Court. In 1905, the Supreme Court ruled in the state's favor, allowing states the power to make regulations that will protect the public health and safety of their citizens, including the mandate of specific vaccines. As you know, there are many vaccines mandated by the state of New York that a child must receive before attending school. All 50 states have similar vaccine requirements, but New York is one of only 5 states that prohibit philosophical and religious exemptions for vaccinations. The only vaccine exemption that is allowed in our state for medical reasons is for medical reasons, and this requires proof from a licensed physician. Although SAR is a private school, We have followed New York State rules regarding this matter as we take our legal and civil obligations seriously as an institution. When an outbreak of measles began in January 2019, and 86% of cases were associated with outbreaks in underimmunized close-knit communities, including 2 outbreaks in the New York Orthodox Jewish communities, measles elimination status in the United States was threatened. New York City and state responded robustly, and on April 9th, New York City's health commissioner ordered that within 48 hours, anyone more than 6 months old who lived, worked, or attended school within 4 Brooklyn zip codes, unless immune or medically exempt, shall be vaccinated against measles. SAR recognized our moral and legal obligation to prevent the spread of our own community within our own community and mandated testing for all faculty and staff to assure immunity. Those who were not immune were obligated to get booster shots. Our very own Dr. Fine required 2 booster shots that summer before returning to work in the fall.
Hila, you have to unmute, sweetie.
Sorry. Furthermore, New York State did not mandate flu vaccines to students in primary school. SAR and U, the health advisory community, determined that the flu vaccine should be mandated this past year in order to reduce symptoms that could be mistaken as COVID, leading to almost 100% vaccination rates, even though many families had not previously vaccinated their children against this disease. We would also like to argue that we have the legal obligation to take all possible measures to protect human life. The New York City Health Code 307 says that no person shall fail to do any reasonable act or take any necessary precaution to protect human life and health. Additionally, the New York City Health Code 301 says where urgent public health action is necessary to protect the public health against an imminent or existing threat, the commissioner may declare a public health emergency. As clearly evident in this health code, in times of crisis, the commissioner can declare a public emergency that makes mandates and that can save people's lives. This COVID-19 pandemic is clearly an emergency, and the vaccine being mandatory would save countless lives. There is no better way to protect our SAR community and the community at large than with this COVID-19 vaccination. As it is the city's obligation, so too it should be our legal responsibility to take every possible action that will help stop the spread of this disease. In addition to protecting students, teachers have a right to a safe workplace. The Occupational Safety and Health Act of 1970, the OSHA Act, signed into law by President Nixon, says each employer shall furnish to each of his employees employment and a place of employment which are free of recognized hazards that are causing or likely to cause death or serious physical harm. And just as there are rules that mandate fire exits, smoking, sprinkler system, asbestos, and water qualities in schools, there should be safety rules that mandate everyone in the building be vaccinated against COVID. This way, our teachers, our more vulnerable population, will be protected from this disease. The U.S. Equal Employment Opportunity Commission, EEOC, has published new guidance aimed at helping employers like independent schools tackle the wave of issues surrounding COVID-19 requirements. The EEOC's new guidance allows schools to mandate that their employees be vaccinated as long as they comply with disability and religious anti-discrimination and accommodation laws. We are facing a pandemic that has taken many lives around the world, affected our social fabric of our lives, and drastically changed the school structure here at SAR since the virus began to circulate. We should treat this vaccine like any other childhood vaccination and use our legal authority to mandate it for the school year, 2021 to 2022 school year, only allowing medical exemptions.
My name is Jill Maslow, and thank you for allowing me to present the economic reasons for mandating this vaccine at SAR. My first argument is that we should do our part to bring our city, state, and nation's economic health back to its pre-COVID state. As you may be aware, the rate of unemployment has risen dramatically during the COVID-19 pandemic, causing many around the country and even some SAR parents to lose their jobs or bring in less income. According to the Cooper Fund annual report, SAR needed to secure an additional contributions to the Cooper Fund due to the pandemic, which helped an estimated 153 families in 2020, providing more than $245,000 for camps, groceries, mental health professionals, medical doctors, and other providers. This report only includes 2020 numbers and has definitely increased since then. In addition, SAR budgeted for an additional $1.9 million scholarship dollars this year since many families can no longer afford their children's tuition. As soon as we reach herd immunity, the sooner the city and state will return to normal business, allowing our citizens and SAR parents to return to the workforce. As you can see from this graph, published on June 5th, 2021 in the New York Times, the unemployment rose steeply when the pandemic hit in March 2020, rising to levels far greater than during the recession in 2008. The country's employment rates have somewhat recovered. We are 61.6% of the way there towards when we were before the pandemic hit. But it's high vaccination rates that will allow us to open more fully and make jobs more available again. As Governor Cuomo has announced, once New York State reaches 70% vaccination, most of the remaining COVID-19 restrictions will be lifted. He continues to say, however, that large-scale event venues, public transit, and schools will be required to continue state guidelines. We at SAR should do our part to help our city and state recover economically, bringing us one step closer to overcoming this pandemic. In addition to working towards our nation's economic health, we should also consider the amount of resources that have been used towards the goal of vaccinating all Americans and ending this pandemic. The federal government, through Operation Warp Speed, paid for the development, manufacturing, and distribution of this COVID-19 vaccine. Operation Warp Speed spent over $12 billion on this most important project, allowing it to be developed more quickly and efficiently than any other vaccine in history. If we don't reach herd immunity by taking advantage of this amazing medical breakthrough, much of this money and effort will be wasted. Mandating this vaccine and even arranging its distribution here at SAR will not cost the school or its families any money, since the CDC and the federal government mandated the vaccine to be free of charge for U.S. residents regardless of citizenship or insurance status. Governor Cuomo has even passed an emergency regulation demanding that employees will be granted up to 4 hours of excused leave per injection. Most importantly, mandating this vaccine will remove much of the financial burden SAR incurred in order to resume in-person learning this year. According to the school leadership, SAR spent $1.5 million to ensure that all COVID restrictions were in place and that its population remained healthy this year. Deborah May, during our 7th grade town hall meeting in early May, informed us that SAR would need to budget another $500,000 for the 2021-2022 school year. If we need to continue our current COVID protocols, we are hopeful that vaccine approval for our youngest students may come as early as September. If that does happen and our entire school can be vaccinated against COVID-19, these additional expenses will no longer be necessary, allowing us to use this money to improve educational and extracurricular programming that gives SAR its amazing reputation. Thank you.
My name is Mohers Hoffman, and along with my partner, Ariel Frankel, we will provide the scientific arguments that support our grade's vaccination mandate recommendation. Most important, the mRNA vaccines from Pfizer and Moderna have been shown to be safe and effective. The vaccines underwent clinical trials before applying for emergency approval from the FDA. Although both have been approved for use in adults, only Pfizer has been approved for ages 12 and up. However, Moderna reported this past Thursday that it has asked the Food and Drug Administration to expand the emergency use of its COVID-19 vaccine to adolescents ages 12 to 17. Both Moderna and Pfizer are currently running clinical trials in children aged 11 and under and hope to have an emergency approval in September. According to the CDC, just under 300 million doses of these two vaccines have been administered in the US alone. And the CDC reports that the Pfizer vaccine efficacy rate is 100% for 12 to 15-year-olds and 95% in adults. Furthermore, according to a report in the New England Journal of Medicine on May 5th, 2021, the Pfizer vaccine is 89.5% effective against any documented infection with the B117, or otherwise known as the UK variant, and 75% effective against the B1351, also known as the South African variant. This is important because the variants are becoming the new normal. The B16172 strain, officially known as the Delta variant, is worrying health officials across the world, including in the United States, since experts believe it is even more transmissible than other variants and may cause an increased risk of hospitalization. A team of researchers at BioNTech and the University of Texas Medical Branch reported last week that they had found evidence that the Pfizer vaccine would protect against infection with the Delta variant and others. In addition to the amazing efficacy of this vaccine, it is proven to be safe as well. To date, almost 300 million doses of Moderna and Pfizer vaccines have been administered in the US alone, with very few serious side effects reported. Although there was some initial concern over allergic reactions, the CDC reports that this occurs in approximately 5 out of 1 million vaccinations. Furthermore, to ensure safety, everyone is required to stay at the vaccination facility under observation for at least 15 minutes, so medical care could be provided in case they should react. There have also been concerns over some cases of myocarditis reported in adolescents and young adults soon after receiving the Pfizer vaccine. Reuters.com explains that while myocarditis can be serious, out of over 5 million vaccinations, there were only 283 observed cases of heart inflammation in those aged 16 to 24. 95% of these cases were mild, and most were out of the hospital in 4 days with a full recovery. Although this number of cases is higher than that which would be expected amongst people of the same age range, a firm causal relationship has not yet been determined, according to the CDC. Even if there is a causal relationship established, this needs to be measured against the risk of COVID-19 vaccine in children, which brings us to our next argument.
Ariel?
Our third argument surrounds the fact that although COVID-19 disease has generally been more severe in adults, we can't ignore the fact that about 16,500 children have been hospitalized for COVID-19 since the pandemic began, and at least 322 have died, making it one of the leading causes of death among children. The Centers of Disease Control and Prevention reported in early June that those of adolescents who were ill enough to be hospitalized, about 1/3 were admitted to intensive care units, and 5% required ventilators. Much of this suffering can be prevented. Dr. Rochelle Walensky, the CDC director, said in a statement, "Vaccination is our way out of this pandemic." We also can't forget that even though many children do not suffer from severe symptoms, we do help spread and transmit the disease when infected. By vaccinating everyone in school, with the exception of those who are medically exempt, we are protecting those who are more vulnerable and susceptible to COVID-19. Lastly, we will argue that mandating this vaccine is the best way to prevent more dangerous variants from forming. Although viruses normally reproduce exact copies of themselves during viral multiplication within the host cell, there is always a chance that the virus will mutate and form new variants. If a variant forms that is not susceptible to the vaccine, then we could have another serious outbreak even within our own community. Vaccination prevents humans from serving as a host to COVID-19, and without a host, these viruses can't replicate. If they can't replicate, they cannot form new variants. As we all know, this has been a challenging year, and we thank you all for your hard work and contributions to help SAR overcome the numerous hardships we faced. We have worn masks, socially distanced, remain in power pods, stayed home when we had symptoms that resembled COVID-19, celebrated Simachot differently than we had planned, missed out on opportunities to spend Chagim and other occasions with friends and extended family, to name a few. Although we have found many silver linings throughout this pandemic, we can't wait to return to pre-COVID SAR experience. With God's help and as a result of many people's hard work, dedication, and intelligence, we have been given a gift, the gift of vaccination, that will help to end, please God, this pandemic. We have the obligation to protect all those who attend and work at SAR, especially those with underlying conditions or those that can't receive this vaccine. We hope that we have provided sufficient reasons, halakhic, legal, economic, and scientific, to support our grade's recommendation to mandate this vaccine for all faculty, staff, and students once it is widely available to all groups. Thank you again for your time and consideration.
Thank you. Can everyone give a round of applause to these amazing 10 students? I'm going to open up the floor to any of our co-hosts, anyone from the medical committee or SAR that would like to ask any questions.
Can I just say that was, I mean, I see it coming out of the chat, but that was really, really amazing. It was comprehensive, it was substantive, it was, I love the categories you just from the beginning, right? Halachic, legal, economic, scientific, that's how we think about everything. And I want to congratulate all of you, all of the presenters and everyone who's worked on this research. And Dr. Fine for really, really, making this project a serious project. I mean, I'm going to ask a hard question, if that's okay. You've definitely convinced me, right? You've definitely convinced me on all four fronts, halachic, legal, economic, scientific, that the vaccine's a good thing. You said that we should mandate it. I guess I didn't hear so much. I'm thinking about halachically, when someone, so let's say 95% of our population, agrees with this and is happy to do it. But when someone comes to me and says, well, you can't force me to do something, right? You can recommend it and you can encourage it, but do I have the right? Does the school have the right? Maybe these are private decisions. Do we have the right to force somebody else to be healthy? Can I force you to, I don't know, eat healthy food? Can I force you to, to exercise enough? Like, that's the part that's hard for me. And I guess just to add a second question, should we tell people you can't be here, like you can't come to school, you can't learn if you don't follow my, these recommendations that we all, I think, are I don't know, I don't speak for others, that I'm convinced about.
Do any of the students, Serena has her hand up. I think that means she wants to answer.
Yeah.
Hold on.
Yeah, can I give an answer?
Yeah, please do.
Well, we are a Jewish Orthodox school, so we do have Jewish and Torah values, and we are allowed to say if you're going to you're not going to follow our Torah values, then this might not be the school for you. And since my partner and I, Zach and I, presented many reasons as to why Halakha points us to we need to get the vaccine to protect ourselves, to protect our friends. Halakha points to that way. So if we're making a halachic decision and using our Torah values, then we're allowed to say for a Jewish school that follows these values, we're allowed to say this is the mandate we have.
So we actually do force halakha within the school, maybe not privately, but within the school, like, right? You can't bring in non-kosher food and things like that. So maybe we can make that argument that halachically, like, this is required. It's not just a private decision because it's something that happens at home and at school because you're in school, you're not vaccinated. Interesting. Thank you.
I see Zach has his hand raised. If you have something else to add, go ahead.
Like Rena said, you make a great point, but like I feel like there's a difference between eating healthy and exercising, which improves quality of life, and really saving people's lives. And I think that's really important, that we have to remember that people are dying. Like the COVID-19 is a real disease, and we need to stop it as fast and as quickly and as efficiently as we can, and I think this is a great way to stop it. And I think if there's no medical reasons, obviously, as I mentioned in our speech, if there's no medical reason that someone can't take it, I think that it's just, I think that, they're not going by the Torah values and the standards that we set here at SAR. And that's why I think that, it is important that we do mandate the vaccine for everybody in the school.
I see Hila and Aderet. If you have something else to add, please go ahead. And if they already said it, you can just let me know. Mo, I see your hand. Okay, sorry, go ahead, Aderet.
Okay, so from a more like legal perspective, I think that we should, my thoughts, as stated in some sections of the speech, is that we should treat this COVID-19 vaccine as any other vaccination, as we mandate the flu vaccine, which was the flu vaccine, and the flu disease was previously very deadly. And we did mandate it for the 2020 school year to prevent like not fake cases, but things that might be interpreted as COVID, so we can easily see who has infected with COVID. So with the COVID-19 vaccine, which has been produced very efficiently, we should treat this as any other childhood vaccine, which requires a document from a medical physician that you have received this vaccine so you can attend school. Then we should treat the COVID-19 vaccine the same.
Okay.
I see that Dr. Rocker has his hand up. Please feel free to unmute and ask a question or comment.
So I just wanted, first of all, this was amazing. Like everyone gave phenomenal talks. I learned a tremendous amount. And even though I knew a lot of these things, you guys put it together in an argument that really made it very thoughtful. And so I'm going to get vaccinated. Thank you. I got vaccinated on day 2 when they opened it up in December. But I wanted to frame Rabbi Krause's question. So you guys talked about halakha, you talked about economics, you talked about legal, you talked about scientific. There is an area of medicine called medical ethics. And the term that they use is autonomy, where we should allow patients to make decisions for themselves. And so I think you guys just offered a good argument that, yes, we are offering autonomy, but in certain circumstances, and I don't remember who said it, who just spoke about eating healthy, that affects you and your lifestyle, but COVID also affects other people. So the decisions you make, it's not just about you, it's about others. But I'm gonna put it a little bit differently. So I'm gonna make it tighten the screw a little bit and say it's a little bit harder. So we talked about autonomy. Rabbi Krause gave a great, sort of put out a great question, and you guys have been answering it. The one difference between the flu shot and the COVID shot is it's not approved, FDA approved yet. It has emergency approval. So does that change the way you guys are thinking? Because let's be honest, like it is a little bit different. So I just want to hear what you guys have to say about that.
Anyone want to take that? Anyone want to answer? Mo, you had your hand
I
up.
can take that.
Go ahead.
Derek. Sorry. Yes, it is people's choices, but it endangers others. So I feel like SAR as a whole, to set an example for the rest of the community, we should say, if you have not been vaccinated and that endangers others in our community that have serious health risks, you could, like many of the other people who spoke said, we have to protect the rest of the people in the community. And yes, the COVID vaccine is protecting yourself, but it's also protecting people around you. And I think that's a big part of it.
Do any of the students, I see Dr. Lisker's hand up. Does any of the students want to comment more directly to the idea of it being emergency, having emergency approval versus full approval? Serena, go ahead.
Again, looking at this from a halachic point of view, as I mentioned, that we are allowed to take, if there's an unknown that this vaccine might have side effects, but there's something that we do know that this vaccine and will stop the spread of COVID, and that COVID is killing people, unfortunately, and that people in our school might get sick and might spread it to people that could get very seriously sick. We are supposed to take that small risk of something in the future happening, as opposed to letting this big risk of having a very dangerous disease spreading. And it's also a matter of like these people, as much as it is approved for emergency use, it's also been approved for that. And these scientists have looked over it. And it's not as though if we knew that there was a definite possibility something bad could happen, could easily happen, this would be approved. There is a possibility of that, but it's not like it's a probability. So when we take that into account and we take the idea of COVID being dangerous, we should be getting vaccinated, even if there's a small percentage that something may happen.
I'm going to let Nava have one more word, and then we're going to go to Dr. Lisker's question.
Well, about the, like emergency use things, like that's a great argument, and like how it's not approved, like completely approved yet for everyone to be able to get it. And I feel like you can't that's true. You cannot like mandate something that's not completely approved for everyone to get it, and you have to be able to give people that choice. But as a school, like you have to realize that if it's being approved and if it's being like still tested and it's like we know it's safe, we know it's like people are getting it, and if they're going to approve it for like little kids, I feel like little kids is not an emergency thing.
Okay, Nava, we're going to move on to Geeta, to Dr. Lisker. Dr. Lisker, could you unmute and ask your?
Yeah, thank you guys. First of all, I want to let you know, I sit in COVID meetings and listen to COVID presentations. I don't know, for the last year and a half, that's all I do. And I think this is the best one I've ever heard. Like, I'm not kidding. And I do not give compliments lightly. I think this is some of the most cogent, intelligent, comprehensive arguments that I've heard. And if you guys want to come to my office and convince all my patients who are vaccine hesitant to get the vaccine, by all means, thank you very much. And I hope I'm going to be able to share this with other people. So my question, and for you, is as students, as 7th grade students, is what I anticipate you may be able to convince, let's say, all your classmates. What advice would you have if there's a 12-year-old or a 13-year-old who wants to get the vaccine and wants to be able to live a normal life next year and has a parent that says, no, you can't get it? Because I think that might happen, especially among peer pressure. Kids may want it and say, well, I want to take my mask off next year and I want to be on teams next year. And even if we let you in, even if I agree that we should mandate it, I really do. But even if legally we can't, whatever it is, we certainly will have different recommendations for kids who have it. So what's going to happen to the students who want it and their parents don't let them get it?
Daniel, do you want to try taking this one? I see your hand up.
Yeah, well, there's herd immunity, so not everybody has to get vaccinated in order for them to take off their masks. So if, let's say, 5 kids in the grade, 5 out of 100 don't get vaccinated, we'll still have herd immunity. We could all still take off our masks.
Daniel, are you saying that even if we mandate it, if there are a very select few holdouts that have very strong reasons against it, that SAR can make that private decision with that family?
Yeah, well, if it's like a medical reason of some sort.
What about if it's not? I think what the team is trying to get us, what if it's not a medical reason, it's just their own, philosophical reason?
Oh, well, I mean, I'm sure they can make some exceptions yeah.
Somebody else can jump in because I see some other hands raised up.
Can I go?
Yep.
I mean, like SAR, like for the safety of other people, we have to make some hard decisions, and this is definitely one of them. Like if somebody's parents do not want them to get it, and they don't get it, like they don't get it, even if there is herd immunity, I still feel like, yes, we should allow them in if there could be herd immunity, but if there's not,
So, okay, Mo, I'm just gonna, yeah, sure, go ahead.
So as stated in my argument, New York City is one of 5 states that prohibit philosophical and philosophical and religious exemptions, for vaccinations, and SAR follows the same rules. So if there is a parent that doesn't want their child to get the vaccine for religious or philosophical exemptions, then they're not following they're not following SAR's basically code of conduct, because we prohibit people from being exempt from the vaccine if they're for religious or philosophical exemptions. So we can't just make a hard decision and let them not get the vaccine because this is a specific event. We have this following, and we follow this as an institution. Even though we are a private school, we make this decision to follow as a state. So we can't just let them off the hook because this is a COVID vaccine. We follow these rules. We should stick by them.
So I just want to add, because then I want to be able to ask Dr. Milner had a question, and I see that Dr. Lerner has one, that one of the the con sides of the arguments when the kids were preparing, both sides for the debate, was that education, right? For those people who sometimes mandate doesn't work because no one wants to be told, some people don't want to be told what to do, that education is the way to go about bringing people to understand this vaccine and get past this vaccine hesitancy, right? So that is an important piece in helping those families who are against it to really encourage them by educating them, and maybe my kids can present to them. Dr. Milner, sorry, you wanted to ask a question next, and then we're going to ask Dr. Lerner.
So just very quickly, again, this was absolutely fantastic. I loved it. I feel like I have to run out and get another shot right now, sort of like Dr. Rocker was saying, even if it's my second or third or whatever. I did one quick point I wanted to make sure that we all had clear, because I think it's important for the class to have this under their arm for exactly the point that Dr. Lister asked, is what are you going to do when someone comes to you and says, but I don't want it, or my parent doesn't want it? The emergency use approval does not differ in any way from a regular approval when it comes to measuring the safety and the efficacy of the vaccine. It only has to do with bureaucratic timing and the such. There is no difference between the way this vaccine was evaluated, except that this vaccine was evaluated more and for a longer period of time than any other vaccine that's been evaluated in America. So I just want to make sure that that's clear. The other point, then the question that I had though is, and it gets a little bit to Dr. Lister's question, can someone tell me what the arguments were when you guys were in class? Everyone seemed to present the argument that everybody agreed, but I would love to hear what the arguments were that went on, because I can't believe that everybody agreed with everything that was just said right now.
Okay, great. So actually, I will open this up to anybody in the class, not just the people who presented, because some of you in the class, did the con arguments. Some people here did as well, but you just have to raise your hand because otherwise I won't see you. Does anyone want to start with like one of the main legal con arguments that you guys argued? Anybody? Sarah, go ahead. Sarah, I'm going to give you the opportunity. Let me unmute you. Can I unmute you? Yes. Okay. Go ahead, Sarah. Give us like one main point. I think I gave you permission to unmute. Yeah.
Okay. Although we are minors, our parents have the right over us to make us get the vaccine. And as adults, people have First Amendment rights to freedom of expression and speech and press. And then the 14th Amendment protects your First Amendment rights of choice. Therefore, you should have the right to choose what you want to do from your First Amendment rights.
Beautiful, right? That 14th Amendment, it was a very big argument. Anybody have anything else that was a strong legal argument that they want to add before we go on?
That's not what the 14th Amendment means. The 14th Amendment doesn't have to do with immunities. It doesn't have to do with vaccinations at all. The 14th Amendment regards slavery and civil rights. So the 14th Amendment cannot be used as a point. Just want to bring that up.
So wait, Darrett, sorry, just to correct that. Now, the 14th Amendment tells the states that they cannot make any laws, right, that take away people's personal freedoms. So that's one of the things that people use to say, well, you don't have a right to tell me what to do. So that was part of the argument for those people who did con. Anybody else want to give a legal con? Otherwise, we'll go on to just for the sake of time, because I see we're on and this is amazing. Anyone want to give a halachic con? Those were a little bit harder to get to.
Can I argue against the what Sarah Back said for a second?
Sure, go for it.
I would just like to say that, yes, the states cannot restrict our rights, but we are not New York State. We are a private school, which can restrict our rights, because as a private school, we have the right, as we did with the flu vaccine, to restrict people's right. And like, we can make girls wear skirts, and we can make boys wear CC, and we can make kids not bring in ham sandwiches or whatever. So if we are, as a private school, we have the right to restrict people's rights.
Okay, who would like to say something about, and again, it can be anybody from the class, who would like, Serena, you want to say something about the halachic con? What were some of those arguments? Give us one main one.
There's a lot of halacha, which actually I use some of it saying you can't harm yourself and you can't harm others. Now, I used it saying that giving someone COVID would be harming them, but you can also make the argument that you are harming yourself. You are putting a needle in yourself, so that could be harming yourself. You're putting a vaccine, which again, as much as I argued against this, it is emergency use. You are putting that, so that could be counted as harming yourself. So that might be a reason why you cannot get the vaccine according to Halakha.
Okay, anybody want to give another counter? I see 7Z raising their hand.
Excuse me?
Wait,
Dr.
hold on
Polly?
1 second. Yeah, Derek, give me 1 second. I see someone 7Z. I would like to give someone else an opportunity. So go ahead, 7Z. Oh, I have to allow you to unmute there. Okay, 7Z, go ahead. Let us know what your thoughts are.
Okay. So I was assigned the con side, the legal con side, and I agree that we should mandate the vaccine for the school, but there were a few arguments that I had that were, I don't know, I guess we should take into account. So the first one is that each state has its list of vaccines that the schools are allowed to mandate. And so all schools that are religious, private, like every school has to follow the list of vaccines. And so there's this list of vaccines that every school has to mandate, no matter what school they are. And then there's the list of vaccines that you can mandate from. So if a vaccine isn't on the list, you're not allowed to mandate it for your school. And right now, the COVID-19 vaccine is not on the list, the New York State's list of vaccinations. So technically, we're not allowed to mandate the vaccine, but I'm sure that soon it will be on the list. And then also, we were talking about emergency use and how but emergency use does not mean it's less efficient or anything, but there is a rule that if it's subjected for emergency use only, you're not allowed to mandate it. So then you have to also take that into account.
Okay, anybody want to, thank you so much. Anyone want to give a con argument for the science side or the economic side, which we did not touch yet? I see Aderet and Nava. Go ahead, Aderet and then Nava.
Sorry, I wanted to say something about the halachic side because I actually was assigned con. And a thing to point out is that with halakha, there is a lot of nuance. Like much of my points that I wrote in the speech for the debate was also used by Rena, who is assigned pro. So there's many ways you can interpret it, but one thing that I found very interesting is that, I can't remember, was it the Rashbag states that you cannot force someone to make a decision based on their health, because Radbaz, sorry, thank you, that you cannot force someone to make a decision based on their health, because that is, you're deciding something for them that is very important. And I brought that up as one of my points, and I thought that was very important for my speech. But another thing to point out, as I said, is that there's a lot of ways you can interpret it. So it's very hard to do a halakha.
Okay, thank you. Nava, I think you were con science. So can you give us, is that what you wanted to mention?
Yeah, I was con science. And I agree that we should encourage and educate people to get it instead of mandating it. But some of my points were that we there are medical reasons that were not considered, like you couldn't be exempt because of those reasons. Like those reasons were not, they wouldn't be, like they weren't considered something that you can get an exemption for. But so you would be forced, even if you were like at some risk or something. And then also that there are countries that are not doing very well with vaccine distribution, and like they don't have a lot of it. So by not mandating it, we would have the choice to take it, but we would not be mandating it. And like everyone in the school, like most people in school probably would get it, but we would have the choice not to, and to suggest, like, to encourage our government to help distribute and donate more vaccines to other countries in need.
Okay, thank you. I'm not sure if Dr. Lerner is still on. Nava, can you mute? I'm not sure if Dr. Lerner is still
I
on.
didn't
If she
see her. I
is.
think she hopped off.
Okay, I think she had to go. I know she had another meeting. Anybody have any last words to say? Otherwise, I think the kids have to start to get ready for their next Zoom class. I see Mo is still raising his hand. Mo, you want to have the last word? And then Rabbi Krause, you can have the real last word.
I mean, I also was Science Con, and I mean, it's not the easiest thing to do, but I do have some points. I was researching the vaccine developed by Novavax, which was 89% effective against regular COVID, like the original strain of COVID-19. And then against the B1351, the variant, it was 50% effective. So like some vaccines do have a very low rate of like protection against variants.
Okay, and Mo, I think what you're trying to say is if we become complacent because we think we're all vaccinated and protected, that maybe there is a chance of another outbreak that would bring us back to square one, which hopefully will not be the case. Okay, so I'm going to actually end it here because it's 10:30 and you guys have been amazing, amazing audience. And I know we took a lot of your time for those of you who came in, zoomed in from other places. Thank you for coming. We hope that you'll take this into account when you make your final decision. Let us know if you need any other, information.
Yeah, that was my only question, Dr. Fine. I want to find these guys when we formulate our policy over the next few weeks.
That's it. And we did tell the kids all know that you guys have the last word. We are just a recommendation and you will do
this
with it
was
what you
very,
wish.
very helpful. Thank you very much.
Thank you. Thank you, guys. You guys were awesome. You made us all very proud. Have a great rest of the day. Thank you, Dr. Milner, Dr. Rocker, Dr.
Thank you for
Lisker, the
listening to us.
nurses,
Bye.
Dr. Lerner. Thank you. Thank you.
so much.
Have a great day.
Amazing job, guys. Take care.
Thank you. Thank you. Thank you.